I want to tell you about a couple who just gave birth to a beautiful baby girl named Sarah. It was their first child and they were beyond thrilled. But after just a couple of weeks, they noticed that Sarah was having some trouble swallowing. Sarah was soon diagnosed with a genetic condition called SMA, which will cause her muscles to become increasingly weak. The couple learns that Sarah will likely never be able to sit up on her own or stand. They are told that SMA is genetic, but they're confused as they have no family history of this. Sarah's parents are what we refer to as a genetic carrier for SMA. We all have 2 copies of every gene in our body. A genetic carrier is a person who inherits 1 copy of a faulty gene, but their other copy works normally. So since they have this backup working copy, genetic carriers often have no symptoms and usually don't even know. But if 2 people are carriers for the same genetic condition and have a baby together, there's a 25% chance that that baby will be affected. Expanded carrier screening is a genetic test that can be done before pregnancy to provide information on your carrier status. And couples can use this information to make family planning decisions. So why is it that we've all heard of 23andMe but not expanded carrier screening? Well, that's because in Canada, guidelines don't recommend offering or even discussing carrier screening with couples unless they have a specific family history. But like Sarah, most babies born with a genetic condition have no family history. Fertility patients are always being seen prior to pregnancy. So that means fertility healthcare providers would have the most opportunity to discuss expanded carrier screening with their patients. Therefore, I wanted to interview fertility healthcare providers across the country to see what are the current practices and opinions on expanded carrier screening, and why does nobody know that this test exists? I found out that providers are not offering this test to all patients. Some are only offering it if a patient brings it up directly or if they're using an egg or sperm donor. And most providers said that they do feel like this test should be something that's offered to all, but they brought up different barriers and challenges they've experienced and listed these as reasons why they don't offer this test routinely. The results of my study will be used to provide recommendations to improve how expanded carrier screening could be offered to all Canadians, empowering families like Sarah's with genetic knowledge. Thank you.